afternoon, Mr. Chairman, members of the board, Dr. Casey. Thank you for the opportunity to come before you today to discuss an update on the activities, initiatives, and challenges of the Fire and EMS Department over the last fiscal year 2024. I'll begin on a somber note in saying that FY24, and can we go to the next slide, please? There we go. I'll begin on a somber note in saying that FY24 represented the third consecutive year of tragedy for the Fire and EMS Department when Captain Jason Ware was killed in an automobile accident on his way to work. Jason was a beloved member of the department and was the captain at the Chester Fire Station. Jason's nickname during his 20-year tenure with the department was Wee Man Ware, and in honor of the first anniversary of his death, the inaugural Wee Man Walk was held earlier this month in Chester. Like so many other businesses who have supported the families of our fallen members, I want to thank Three Leg Run Brewery for graciously donating their proceeds on the day of the walk. And their original intention was to donate it to Jason's family. And at the request of Jason's widow, she wanted it donated in Jason's name to the Firefighters Charitable Foundation so that they could help others in times of need. So that was very nice of her to do so. June and July of this year marked the second and third anniversaries of the line of duty deaths of firefighter-paramedic Alicia Monahan and firefighter recruit Tyvon Eldridge. Last week, their names were added to Virginia's Public Safety Memorial at Capitol Square. A ceremony will be held on September 14th at 1 p.m. to commemorate all of the names that are being added to the memorial this year. Despite our collective grief over the past several years, our members continued to report for duty each and every day in service to our community. Throughout the year, we recognize many of our members who went above and beyond the call of duty, bestowing 4 Medals of Valor and presenting over 100 unit Life Save Awards and 27 separate Life Save Awards to individuals, including ordinary citizens who performed extraordinary deeds. We also celebrated the success of 22 members of the department who were promoted to positions of greater responsibility. Next slide, please. Back one. There we go. In December, 2 Chesterfield police officers and 5 firefighters were recognized by Valor RVA for their actions at 2 separate water rescue incidents that occurred just days apart in July of last year. These awards exemplify the great partnership that exists between our police and fire departments, a close relationship that unfortunately does not exist in all communities. This evening, the board will be recognizing the recipients of the NACO Awards, and we will proudly be accepting 3 awards for various initiatives over the past several years. The American Heart Association recently awarded the Fire and EMS Department with Mission Lifeline, an award that recognizes EMS agencies for using evidence-based treatment guidelines to improve patient outcomes. Throughout each year, we continually look for the best candidates who will uphold our core values and deliver unparalleled customer service to the residents and visitors we serve. We conduct semi-annual hiring processes to fill the ranks of our recruit academies, and last year we continued to receive just under 400 applications on average in each process. I'm happy to report that the most recent recruitment process underway produced nearly 500 applicants, and I believe this is due in large part to the public safety starting salary increases that were recently approved by the board. Thank you for that support. Successful implementation of a 7-month recruit academy is no small feat, and completion of that academy can be very challenging for our recruits. We always plan for up to a 20% attrition rate for each recruit school, and we do that through overfill positions that are approved by Human Resources. Over the last year, our recruit school attrition rate was below the 5-year average at 14%. The top 2 reasons for a firefighter recruit not succeeding in the academy continue to be failing grades, particularly in the EMT portion of the training, and poor physical fitness. The total turnover among uniformed employees has returned to pre-pandemic levels, with retirements accounting for nearly half of this turnover. The second biggest driver of turnover last year was career change, where some employees pursued better opportunities and others sought employment with better work-life balance. Thanks to the Public Safety Pay Plan and the recent adjustments necessary to remain competitive in the market, the number of individuals pursuing employment with other fire departments has remained relatively low, and that's now driven largely by other reasons besides pay. FY24 was another busy year for incident activity. Service demands were up less than 1% year over year. However, the department set another record in responding to over 51,000 total incidents last fiscal year. As in past years, nearly 80% of these incidents are medically related. Current trends suggest that we are on track to exceed 52,000 incidents during the current fiscal year. The Fire and EMS Department transported over 26,000 patients to hospital facilities in the regions last fiscal year. 54% of these patients were delivered to facilities within Chesterfield County. Just under 60% of these patients received basic life support care, while just over 40% received advanced life support care. Nearly half of our patients are transported to Chippenham and Johnston Willis hospitals, and the Chester Emergency Center continues to outperform expectations and has become the busiest freestanding ED in the entire Bon Secours and Mercy health system. It was very surprising to hear that the other day, but I'm certainly aware of the volume that's going on at Chester. Over half of our patients are also HCA patients, so we continue to actively support Chippenham and Johnston Willis hospitals in their plans to relocate the Swift Creek Emergency Center and to build a new freestanding emergency department along Route 10 near the Nash Road extension. Among the department's 23 fire districts, the growth in call volume averaged 2.5% last fiscal year. The districts with the most added calls were along the western edge of our urban response zone, where much of the county's growth is occurring, including Magnolia Green, Swift Creek, and Midlothian. The busiest district continued to be that served by the Beaufort Fire Station at 4,069 incidents. The busiest fire station last year was the Centralia Station at over 5,000 emergency responses. And the busiest engine company continued to be Engine 209 from the Beaufort Fire Station. And Medic 211 was the busiest ambulance or medic unit at the Dale Fire Station. The Fire and EMS Department responds to hundreds of structure fires each year. Last year, there were 24 structure fires that resulted in losses exceeding $100,000. This number of significant fires was higher than the 5-year average, and collectively, these fires resulted in losses totaling over $8.9 million. The top 2 places of origin for significant fires included exterior areas such as porches and balconies and kitchens, and these 2 areas are not surprising. Countywide, the leading causes of all structure fires include cooking, electrical, and discarded hot or smoldering materials. With the support of the board and county administration, a major initiative to reduce the reliance on overtime, and in particular mandatory or forced overtime, is nearly achieved. 36, great job. We've made a lot of progress here. 36 of the 48 new firefighters authorized in recent years to increase the department's relief factor to 1.32 have been hired, trained, and assigned to emergency operations. As a result, I'm happy to report that we have seen a 54% reduction in the frequency of mandatory overtime and a 29% reduction in actual overtime costs year over year. We expect to see further improvements once the remaining 12 firefighters complete recruit school in late December and begin supporting minimum staffing needs in the field in the second half of this fiscal year. It's important to remember that a 1.32 relief factor is premised on an analysis that is now 5 years old. And so a lot has changed since then. 75% of our employees are now under the PTO program with higher accrual rates and greater flexibility in leave utilization. Bonding leave has been very popular in our department, and over the last year, 36 individuals took a combined 13,840 hours of leave under this new benefit program. Accordingly, once we get a full year of data on all of 48 of these positions in the system, which will be next fiscal year, 2026, we'll complete another analysis and look at whether or not we need to increase that relief factor for future years. But good work, and thank you all for your support over the years on this effort. Several alternative programs for EMS continue to be highly successful. The first and foremost is our mobile integrated health program. We continue to see significant year-over-year increases in the number of patients enrolled, many of whom would ordinarily or otherwise be high users of the 911 system. We've also seen an increase in the number of patients opting into our substance abuse program. It works with an embedded peer recovery specialist, which is just one of multiple efforts countywide that is helping reduce the number of overdoses and overdose deaths. A new agreement with Molina, which is one of the Medicaid providers in Virginia, is producing some limited revenue for the MIH program. But more importantly, we're hoping that it will serve as an example to the federal government that the MIH program and other strategies similar to the MIH program will be cost-effective ways to deal with pre-hospital needs in the future. During the first year of operation of our peak demand ambulances, the first full year rather, the 3 units together handled over 2,000 responses for low acuity patients and improved the response reliability of the busiest ambulances in the county. Both of these programs will be well suited for expansion in the future to more effectively manage growing patient demands, particularly with the increasing number of patients that are going to be 65 years of age and older. In partnership with the Nova Blood Services, the Fire and EMS Department was the first ground transport EMS agency in Central Virginia to implement a whole blood program earlier this year. During the second half of FY24, paramedics administered whole blood to 10 seriously injured patients. Mr. William Jesse, pictured here, was the first patient to receive whole blood following a serious motorcycle accident this year on Hull Street Road. And he graciously stopped by Station 24 recently to thank the firefighter paramedics who saved his life. The new Matoaka Fire Station began operations on June 17th, and I believe, Mr. Carroll, you would agree that it's been a welcome public safety asset in rural southern Chesterfield County. So thanks again to the board for allowing us to replace the old aging facility with a new modern facility that will serve for decades in the future. The official dedication and ribbon cutting ceremony will be on September 4th at 10 a.m. and the public is also invited to an open house on Saturday, September 7th.
Chief, in that regard, I want to compliment you and your departments on this excellent article in the Times-Dispatch, and it labeled "Using Data to Perfect Location of Fire Stations." This was a wonderful front page ad that I greatly appreciate, and I kept it just so I could share it with others and you and your department. So what a wonderful job, and you demonstrated leadership in that area, sir, and I just applaud you for that.
We've actually already had a request, right? The Louisa County Administrator reached out and we put them in touch with our team, our planning team, and they met yesterday via Teams and talked about our processes as to how we select a new station site. So we're always willing to help others, just as we've learned from many other fire departments as well.
Thank you.
So the design of the new Chester Fire Station is well underway. The new facility will replace the outdated station that has faithfully served the community since 1962, but was never really intended for around-the-clock operations. The new station will be constructed on the recently approved site in the 4700 block of West 100 Road. A major challenge that remains for the Fire and EMS Department is the continued decline in the participation levels of our volunteer rescue squads, a trend that is not unique to Chesterfield County. The most impactful issue on our overall EMS system has been the continued decline in staffing during weeknights and weekends by the Manchester Volunteer Rescue Squad. During FY 2024, Manchester was only able to cover 36% of their duty crews, which in essence shifted calls to surrounding career ambulances that each experienced between 2,000 and 2,500 responses last year. A key metric that we follow is unit reliability, or the percentage of time that a unit is marked in service, is staffed, and available to respond to the highest priority medical emergencies in their response district. Manchester had a reliability of 23% last year, well below the goal of 80% for ambulances countywide. Conversely, this means that during FY 2024, 77% of the time medical emergencies occurring in Manchester's response district were handled by other ambulances traveling further distances. It's also worth noting that fewer EMS transports results in less billable revenue, from which the Volunteer Rescue Squad can purchase supplies, replace EMS equipment and ambulances, and raises concerns about the long-term financial sustainability of the squad. In addition to Manchester's struggles, I'm also concerned by the significant drop in coverage by the Ettrick-Matoaka Volunteer Rescue Squad, where 25% fewer 12-hour shifts were covered during FY 2024. We'll continue to monitor these performances of our volunteer rescue squads, work with them in any way we can, and continue to work with the board on future corrective action as we look to future budget years. Chesterfield County continues to experience robust growth, adding more population than any other single locality in Virginia in recent years. With that growth comes thousands of units of single and multifamily dwellings, mixed-use developments, and very large, complex commercial buildings. As we work to develop response strategies for this new reality and have gained some experience in actually fighting fires in some of these new buildings, we've realized that our fire company staffing levels that may have been suitable for years as a traditional suburban environment are no longer adequate for the new environment that we're facing. Accordingly, with the support of the county administrator, we've applied for a federal Staffing for Adequate Fire and Emergency Response, or SAFER grant, that will provide salaries and benefits for 3 years for 16 new firefighters that will allow us to increase the minimum staffing levels on 4 of our engine companies to 4 firefighters each. That includes Engine 201 in Chester, Engine 205 in Midlothian, Engine 207 in Clover Hill, and Engine 218 in Rivers Bend. If we're successful in this effort, we will continue to pursue SAFER grants year over year to incrementally increase the minimum staffing levels on additional engine companies over time. Lastly, since I last updated you on the progress in completing recommendations that were included in the ESCI report, we are at a point now where we've picked the low-hanging fruit, and we're now moving into a phase where the balance of recommendations will remain in progress or pending for a considerable period of time. Many of the remaining recommendations will require significant investment of time and resources and will not be accomplished quickly. We continue to work with the Learning and Performance Center to finalize and publish our new strategic plan, and those recommendations from the study that can be reasonably pursued over the next 5 years will be included as goals in the new strategic plan. And we'll be certain to provide each of you with a copy of our new strategic plan once it's published later this year. We're also kicking off our journey to accreditation. And later this fall, we intend to file for applicant status, and our goal is to be accredited by the time of the hearing in the summer of 2026. This is an 18-month journey, and a lot of work is still to be done, but we're starting to pull together a team to get all the documents that need to be written, revising our policies and procedures. We're looking at the way we track data and report data to make sure that we're in line with the requirements of the Centers for Public Safety Excellence. So that's going to be a very in-depth journey over the next several years, but we look forward to that and the continuous improvement that it will bring. In closing, if you haven't done so already, I'd ask you to please follow Chesterfield Fire and EMS on social media. Our Facebook account has over 22,000 followers. Our new public information manager, Lauren Russell, who comes to us from Channel 6 after 20 years as an executive producer there, is doing a great job highlighting the good work of our members each and every day. And so good. I would love to have you join us on our social media and follow us each and every day. Mr. Chairman, this concludes my presentation, and I'll be happy to answer any questions that you or the board members may have.
Thank you, Chief. Questions, supervisors?
Yes, sir.
Dr. Miller.
Thank you, Mr. Chair.
Mm-hmm.
You were saying that folks were leaving and going to other stations, but for other reasons,
Sure.
not necessarily about salary. I'm curious to know what those other reasons
So we
are.
had 5 individuals that went to other fire departments last fiscal year, and so we had one who went to Harrisonburg. He lived in the Shenandoah Valley area, was intending on relocating here after he was hired. He had about a year with our department. His family is there, child care is there. There was no intention at some point. They decided not to move to this area, and so the drive was getting to be too much. And we had a long discussion. He wanted to know that he really loved being a part of this department, but needed to be closer to home, and so we respect that. We had another that went to Defense Logistics Agency, to their fire department, because he had previous military experience. He was able to transfer that over for credit towards retirement there. And then we had 3 individuals that did go to the Richmond Fire Department, and mostly it is to be a city firefighter, to go to a chance to fight more fire and perhaps not be assigned to the ambulance as much. And so that seems to be the draw that we have in other fire departments.
Thank you. And one other question around the 57 recommendations that
Yes.
came out of that report. I'm curious to know, you said you finished the low-hanging fruit. I'm curious to know what are the ones that are the other end of the spectrum that we really want to be facing, that we want to be paying attention to help you out?
So a lot of it surrounds the staffing needs, okay, for the future. So the relief factor was a big recommendation in there. So we're making that change now. We'll need to look at whether that's going to be effective for the future, and whether we need to open up more guaranteed leave slots, okay? With more people in the system, we need to be able to provide more opportunities for them to take their leave, so that they don't get into a use it or lose it status. Okay, so that's one big heavy lift. Certainly, the recommendations for new fire stations. For the next few years, the bond referendum certainly has a lot of the headroom in our debt capacity spoken for, and a lot of the investments in the county. But after that point, at some juncture, when that headroom opens up, we want to look at possibly adding some new fire stations. I know we've had a lot of discussions about the Highlands Fire Station, which would probably be next on our list as a new fire station. So there's a number of recommendations for new fire stations, which quite frankly are going to take years to build because of the cost involved, not only to build them, but to operate them annually. Staffing increases, again, looking at trying to align ourselves closer with some of the national standards out there so that we get to 4-person staffing where possible on our fire engines. That's our big focus for the next foreseeable future, trying to get some grant money to get the individual units staffed up. There are recommendations in there about, again, monitoring our volunteer rescue squads and being prepared to take over coverage. It's one of those things that we're seeing across the U.S. that volunteerism is on the decline. It's a very difficult duty and responsibility for somebody in a volunteer role with all of the other challenges of work-life balance. And we're just not seeing as many people that are willing to step up or able to step up and serve in that role in the future. So those are just a snapshot of some of the big ticket items that we need to look at for the future, and will take years to accomplish.
Great.
Just as in something, I was recently at a dinner with everyone who was volunteering. It was quite a room with a lot of energy. But I'm curious to know, it felt like, and you probably get a better number than I do, there was easily 50 people in the room. I'm curious to know, just the county-wide, what's the total number for volunteers?
So you can look at it a couple different ways. So if we were to ask each of our volunteer organizations to give us a list of their volunteers, we would get a probably very lengthy list. But a lot of those individuals are either in administrative assignments, they might have retired from running calls, and maybe they're senior members or lifetime members. And so it really you start whittling it down, and you have a very small number. And I would estimate, right off the top of my head, probably about 125, what we would refer to as actual operationally capable volunteers in our system. And I'll follow up with you all with the latest numbers, because it's a moving target. Right. And so these would be people that are, for the rescue squad, they're certified as a minimum of EMT. They have all their skills checked off, and they're able to respond on calls. That's where the rubber meets the road. There's probably a lot of other good things that our volunteers do behind the scenes in administrative roles, or as senior members or retired members, but we need people that are capable of running calls. That's where the rubber meets the road, and so those are the ones we count from an operational perspective. But we'll make sure to follow up with you all on that.
I was just struck by the kind of energy that was in the room.
Yes.
And just the sense of community that was in the room.
Absolutely.
So as far as anyone who might be interested in volunteering in this area, wow, it's like adopting a family. It just really is such a sweet way to be part of. And so I really want to put that out there. There are a lot of things that you can volunteer on, but this is something that really is, in so many ways, just such sacred work.
It is.
And it is.
And this is a hard conversation to have with you all here in an open forum, because it is, we care about our volunteers, we're supportive, and we want them to succeed, and we always keep the door open for volunteerism wherever possible. But we have, a job to do here, and we have to meet the needs of the community on critical emergencies. And when that gap opens, we've got to be ready to stand in and fill that void. And it's it's becoming a little bit more difficult over time to make sure that gap gets filled all the time.
Thank you.
Other supervisors? Snyder.
Sorry. So I'm so sorry that I missed Jason's walk run. Kenny Mitchell had called me and asked me, but I was in Wisconsin at the time, so I know that Operation Yellow Tape was there, and they helped out with that also. But I wanted to be there, but I was visiting my daughter, so I'm glad that they were able to do that. The Manchester Fire Station, was there not talk about possibly hiring or getting enough staff that we could possibly turn that into a full-time house?
So
Is
we
that-
do, in the 5-year plan, I believe it's FY '26, there are 8 positions that are recommended,
Yeah.
obviously depending on funding available
Okay.
and the decision of the board, but there were 8 positions that are in '26 in the 5-year plan, yes.
Yeah, I just think that's I mean, the amount of calls that are getting deferred
Yes.
to other places, I think
Yes.
that's a really busy area, that I think that's something we really need to look at.
And
So,
we've done our best to try to fill it when we can. If we have, unassigned, what we call detail positions, with some of the additional staff that's been coming in for relief, we do have days where we can staff it at night. We staff that ambulance there during the day
Okay.
as a matter of practice, and we've done that for years. But at night and weekends, we would turn it over to the rescue squad. We try to fill it when we can, but it doesn't happen all the time.
Okay, yeah, thank you.
Thank you. Other
Yes.
supervisors? Supervisor Carroll?
Mr. Chair. Thank you. I know we used to have a program years ago where we would actually work with the youth in our school systems to try and get them interested, and that since has gone away. I really think that other communities continue to, because let's face it, the majority of the United States is volunteer firefighters. It's not all full-time firefighters. You go out to some of the even just west of us at Amelia and other places, they're volunteer. And they continue to get new volunteers to come in. It is diminishing. I mean, even if you look at the job report today, one of the things they talked about is the fact there's probably 55,000 teacher vacancies in the United States right now. So there's a shortage in almost every single workforce between, whether it's fire departments, police departments, or any public. And, I really think that we need to take a look at this to see what we can do. For example, what the police department's doing with their police service aides. We're recruiting kids right out of school that we hire in this role, and then when they're old enough, they can actually become
Exactly.
a police officer. Now, for firefighters, they probably eligible at 18. But we got to get them younger, right? So I know I was a volunteer fireman at 15 years of age, and so when we had a bunch of junior firefighters back then, and I know it's a litigation issue now, we talk about the safety of the kids and that kind of stuff, but we got to find a way to get them involved, to get them interested. And we may end up getting volunteers that want to eventually become full-time firefighters in Chesterfield County, or stay volunteers for the rest of their life. But I don't think we can just leave it to the volunteer organizations, because we're seeing that they're not being successful. So we got to figure it out. And I think that, if we need to put a group together, committee together to work with them, to work with us, we need to do something. We're the largest municipality population-wise in Central Virginia. And, we graduate about 5,000 kids a year from our school system, and I just can't imagine that none of these kids want to be involved in this. And sometimes it's actually getting them exposed. So anything you come up with that we can help you with that,
Okay.
I think we're on board for that.
We're actually putting together a proposal that you'll probably see in a few months, and I know Mr. Engel and I have had some discussions about a police service aid type of program, and what interests me is capturing some of these kids that are coming out of the high school programs, because there's still, the fire science program, if you will, or the firefighter program that we had at CTC Hull, I don't think is no longer viable. There's still EMT training that's going on there, and I believe at Monacan. And then we have at Bright Point, we have an EMT program. And so trying to capture some of those folks and get them in, and maybe this is a way to expand our peak demand ambulances. Maybe we can get them involved in some other activities that our MIH program, get them some patient contacts, and then, hopefully get them segued into the fire academy. If they're not interested in being a cross-trained, multi-rolled firefighter, then maybe this is a stepping stone to another occupation in the future, or like you say, into volunteerism of some sort. But I think there's some opportunities here we'd like to take a look at. Obviously, the biggest priority we've had the past couple of years is dealing with that relief factor. And so this would be a new program that we would have to start, have to be properly resourced so that we have appropriate leadership and control of the program as we went forward. So. But you'll hear more about that in a few months, I'm sure.
Mr. Chair.
Thank you. Yes?
Yeah, I mean, like I said, it's about setting yourself up for the future
Yes.
for new people. And we can't always do things where we've always done them. Because as you said, volunteerism across the United States is going away. And I think sometimes it's about, and no matter what it is, whether it's kids that are getting involved in, we'll say, hunting. Well, some kids have never had the opportunity because no one in their family hunted, and then you get them involved in it, and they're like, "Oh, I want to do this." And I think, being a firefighter or a police officer or a teacher, there's an apprenticeship program they're doing in another state right now, in Texas, I believe it is, to actually help teachers get their education to actually become a certified teacher. So they actually hire them into school systems, pay them a salary, and help them get their qualification to go to college and get their pay for it. So we just need to be innovative and figure out how we want to do it. And I just want to know you got our support if you come up with a good program.
Okay, well, thank you. Appreciate that.
Thank you, Mr. Carroll. Mr. Engel.
Couple things. First, your slide on, or your statement on how our public safety in Chesterfield County works together very well, and unfortunately that doesn't happen in every jurisdiction. I really appreciate that comment. We make that comment as board members all the time, but coming from a leader in one of those areas making that statement, I think reinforces what we're saying. So thank you for sharing that. I'm glad that we've been able to make a dent in the 1.32 relief factor, and we have a little ways to go, but we have a plan in place that with this academy we should get close unless we lose too many others to attrition or leaving to something else. But I think that, as you said, it's important that we put the other firefighters out there, the 48 that we added, to get that relief factor down so that we could, that mandatory overtime was causing us more attrition, and I do believe that that's changed a lot
It's
in the
very
county.
noticeable in the field and very much appreciated. The
And
relief is-
we've heard it from the firefighters in the county, so I'm glad we were able to work together on that, and I hope that the SAFER grant comes through so that maybe we can get those 8 other firefighters to go full-time in that station. And I'm really thankful that I heard you say that the program we talked about before, how can we emulate the PSAs, that you're actually working on how to figure that out, and I appreciate your work on that. Thank you.
Thank you.
Thank you, Mr. Engel. And Chief, I just want to thank you for your outstanding service and work, especially as it relates to overtime, which has to do with the quality of life of our workforce, which is one of our major initiatives. And so I applaud you for that, and the culture that you have in the fire department of family, of brotherhood. You see it evidently when we visit graduations, when we visit funerals. We see that, and so I applaud you for that. Also, thank you for mentioning the fire station in the Highlands. That was one of my points to ask about, so you already alluded to it, so thank you, and I applaud that. And in addition to, I just want to mention that please congratulate Matt Coffin for his excellent comments in the Times-Dispatch relative to the new fire station there in Matoaka. That's outstanding, and so please continue to let us know so that we can continue to advocate for you when it comes to budget time needs that you have. We always have to balance our receipts with our expenditures and tax relief and all those things, but as you well know, this board and all boards I've known really prioritize very highly safety, and that's fire, police, and all other departments, and so we applaud you. So please let us be help for you as you continue to advocate with the budget department, with Dr. Casey, to make sure that we're getting the very best there and balancing the needs of our workforce as well as the needs of the community with regard to tax and tax relief. So again, I applaud you. Thank you for your outstanding work, and just keep up the great work, Chief. And I'm looking forward to that fire station in the Highlands, too. I just might want to plug that right now. And another plug for that fire station, Chief. Given what we see coming in the near future relative to Courthouse Landing, the new hospital, and other entities in this general central area. Thank you very much
Okay.
for being here
Thank
today.
you all for your support.